If you want a simple, evidence-based pantry upgrade for healthy aging, don't look for a miracle food. Look for a staple that appears again and again in long-living dietary patterns. Start with legumes, beans, lentils, chickpeas. Large observational studies link higher legume intake with lower risk of early death. The size of the association is modest. Think a few % lower risk, not magic, but it's consistent. The key point, legumes often replace less healthy foods. Important for seniors, canned foods can be high in sodium. Choose no salt added when you can. If you use regular canned beans, drain and rinse them under running water. If you have heart failure, kidney disease, or you've been told to limit sodium or potassium, use your clinician's plan as the priority. Next, oily fish. Sardines are a practical option. In a randomized trial in adults over 65 with pre-diabetes, adding about 200 grams of canned sardines per week, roughly 2 servings, improved diabetes risk markers and produced a small blood pressure reduction within the sardine group. That does not mean sardines guarantee protection, but they are nutrient-dense, omega-3 fats, protein, and, when the bones are soft and edible, calcium. If you have a fish allergy, swallowing problems, or you're on complex medication regimens, be cautious and discuss diet changes at your next visit. Third, canned tomatoes. Cooked tomato products, especially eaten with a little healthy fat like olive oil, can increase lycopene absorption compared with raw tomato alone. So a simple tomato sauce, stew, or soup can be a convenient way to include this. One last point. The best evidence supports a pattern: more legumes, whole grains, vegetables, nuts, and fish, less ultra-processed food, and less red and processed meat. Pick one change you can sustain this week. Add legumes a few times, choose low-sodium canned options, and build meals around simple, consistent staples.